What I'm going to talk about tonight just briefly is child abuse education for medical students, and really talk about how that we've done this. And this is a lot about working as a team, so I have to recognize our team. Vidya Permeshwar is, I think, the only member of our team that's here. Vidya, oh, okay, we got another one there. Vidya is our clerkship director and vice chair of education for the Department of Pediatrics. Ann Rashofsky is their residency program director, and one of my former colleagues is a hospitalist. Ann Laverty is med peds, and she's new. She's been here a year now. And then I have to give special credit to Tony. Tony Slonim has been with us, I guess, less than a year, but Tony's incredibly dynamic and really pushed us to put this together. So just a little bit of background. You know, physicians really have an important responsibility to recognize abusive situations. And we have a legal responsibility as pediatricians. If we see child abuse and we recognize it as child abuse, we are required by law to report that. And if we don't, we're could be subjected to a fine and so forth. And obviously it's an ethical thing to do as well. And it even goes into the adult world because there's adult abuse as well. In the literature, there's a lot of, you can find a lot of things about what to talk about when you talk about child abuse. And I've lectured, this is an area of interest I've had ever since I've been in my career. And when I give lectures, I usually talk about how to recognize children who have been abused, what it looks like, what what predisposes them, et cetera. But we don't talk a lot about as much about reporting and how to do that and so forth. So this was really focused on more of how to work within a team to get the best result for the child. So we focused on the concepts of teaming and change agency management and advocacy when we delivered this. Because we were looking at how effective this would be for the students, how they did it rate well, did they receive the information well. So this seminar, basically, it's a half-day seminar, really goes back to the foundations of VTC-SOM. And when VTC was first founded, they had a concept of what was called domain days. And I think it was every month or every 6 weeks, the third-year students were removed from their clinical clerkships. And on Friday afternoon, they had a 3-hour educational session delivered by each one of the departments. And Pete's had 1 per year, and some of the larger departments may have had 2 per year. And that was well and good. But we had some caveats around that. The first one was, let's see if I can get this pointer to work here. Yeah, so anyway, the 4 domains of the school were basic science, clinical science, research, and at that time, this maroon block was called interprofessionalism. So our task was in that 3 hours to have a topic that would cover those 4 domains. Now, we could cheat a little bit. We didn't have to equally represent all of those, but we at least had to touch on one of those. But the last bullet point was the real tough one in my mind. It had to be innovative. It had to be something different. It couldn't just be a 3-hour lecture on how to treat asthma or how to, child development. It had to be something special. So we worked on that for a long time. And we came up with this idea, partly because, I was in the mix and this is my interest of mine. But anyway, really to this idea of interprofessionalism, because that's a pillar of the medical school. But let's face it, at least when I was in training, doctors are taught to be autonomous, and just working within a team is not necessarily within our DNA at times. And so, but in this issue, in this diagnosis of child abuse, to get the best outcome for the child, you've got to work within the team. And within the hospital, we work in a lot of different teams. I work with respiratory therapists, work with nurses, but this is beyond the hospital with a whole different system. So that's what we were trying to focus on. And let's face it, it's not part of standard education. I know that when I give a talk on child abuse, I'm getting ready to teach the residents on that topic for several hours. I'll have a slide or two about what it means to be a mandated reporter, but I'm not going to spend a whole afternoon about that. And so, and this, again, our goal here is to help them to understand that to get the best outcome for your patient, and we're using the model of child abuse, but it can be extrapolated to any other thing that you've got to be able to work within the team to really achieve the best outcome for your patient. And it goes from that micro system of I'm working with the patient to a little bit of bigger system to I'm working with my patient, I'm working with the surgeon, I'm working with the radiologist to really understand these x-rays. Now I'm working with, the social service agent, and I'm working with the police officer. Then I've got to work with Commonwealth's attorney. I've got to work within those ever enlarging systems to really have a good outcome. So if you look back, and a lot of this, the statistical information came from the school, but the Domain Day series, the pediatric one, has been well received throughout the year. So we've done that. We've been highly rated. But we got a curveball thrown at us a few years ago when the health system science talk came about, and we had to figure out, okay, how do we take what we've been doing successfully, how do we modify it to make it fit the requirements of health of the new curriculum? What do we do? So our department really decided we wanted to focus on social determinants of health, and we also made some tweaks in this seminar. So this started in the academic year 2021 through 22. We really focused on this topic even more on trying to look at systems and looking at it at this topic through a systems lens. We wanted to broaden the awareness of social, cultural, and structural factors such as ACEs, and I'll mention, if you don't know what ACEs are, I'll mention those in a minute, and how that contributes really to the outcome of these children. And we mapped these concepts to program objectives. So we tried to be a little bit more structural with what the school really wanted here. So I think most of you are aware of the, I've seen this chart before, but this is the thinking around health system science. I'm sure those in the medical school have seen this ad nauseum. But we really focused on two elements. We focused on the teaming aspects, and we focused down here on the population, public, and social determinants of health. That's where we were using this, what used to be called Domain Day, now System Science session. So these are our course objectives. I won't read them all, but we do have we still sprinkle it with, while we focus on interprofessionalism, that's the focus. We still sprinkle with other clinical science and basic science such as epidemiology. We do teach them at least a little bit about family violence and what abuse might look like. But what we're really focused on down here are is mandatory reporting. We focus on the system, the different components of the system, like the civil and the criminal justice system, the different people that can help us out, like forensic interviewers, and so forth. So those are the stated course objectives. I do want to mention ACEs because I think this is important. Obviously, I'm a pediatrician. I focus on the little ones, but my goal as a pediatrician has always been, I want to launch this little individual out into society in a healthy manner. That's my goal, right? So this is an old study now, but it's probably 15, 20 years old. But Casu Permanente, it was a large population study, looked at the outcome of children who had experienced these adverse childhood events, ACEs. And they chose these 10 adverse events. And it'd be logical to say, okay, if you've been abused as a child, you might have mental health problems when you get older. But what they also found was children who had experienced these events not only had mental health outcomes that were poor, they had more cancer, they had more heart disease, they had other health problems that you wouldn't typically think would be associated with those adverse events. And if you look at that, under abuse, we have 3. Under abuse and neglect are lumped together, so that's 5. And then if you lump in interpersonal violence, with the mother being treated violently, 6 out of 10 have to do with violence or neglect in the child. So, part of the education here is, yes, that little 6-month-old that you're looking at that's got bruises or fractures, yes, you want the best outcome for them, but let's think about it. You may be impacting their future life when they're 50 years old. They may have less cancer if you could do that. So we're trying to get these concepts across to them. So, the session has evolved over time. We have, at times we've had exams. We don't have an exam anymore. One year we included essay questions. Those were great, but boy, are they hard to read. And, they're from an educator standpoint, it take a lot of time. We have decided to move that we have a straight up didactic lecture. It's about 30 minutes. We decided to move that up to the beginning of the day because we started doing this in July, and our 3rd-year students have very little clinical experience at that time. And we were finding, they don't understand this clinical stuff. And actually, this is a difficult topic. So it was hard for some of them. So we tried to get at least to set the tone a little bit at the beginning of the day. And what we most recently have changed is we brought our presenters back for a wrap up at the end of the day. So what's the design of the day? So first off, we start with a little bit of pre-work. So we send the students a de-identified case. It's done in the style of the VTC SOM cases. It's of a child who had a significant liver injury, bruising, and that was clearly preventable. It had been recognized by the physician when the first presentation occurred, and it was a life-threatening illness. We give them a review article. So they're supposed to do that pre-work. And I always ask when I start the session, how many did their pre-work? I want to know if people are honest. And they're honest. So about 10 out of 40 haven't done their pre-work, but I appreciate their honesty. Anyway, we start with an introduction, then we introduce the team. I review the case. The case doesn't have pictures. I show pictures because seeing the bruises, seeing the CT images are really important to understand the extent of the injury. Then we start with our, I don't give the conclusion of the case though. And then we have a formal lecture on abuse. The meat of the day though are these breakout sessions. And we have 3 40-minute breakout sessions. So that takes about 2 hours. And that's where we bring in the multidisciplinary team. So I have representatives from law enforcement, Commonwealth's attorney, we match them up together. I have representatives from Child Protective Services and a forensic interviewer. Now, most people don't even know what a forensic interviewer is. And I bet you if I asked the group, you probably wouldn't know what a forensic interviewer is, but they're wonderful people. A forensic nurse and then a physician. And we team up and we present together. The goal of these sessions is not meant to be a lecture like this. It's meant to be interactive. We break up like that because I want the students in a small group, and I hope that's more conducive to interaction. And it's really to emphasize their role in this complex system. So there means the law enforcement of the Commonwealth, what's their role, but it's also to what's the student's role in this complex system. Because again, a key point we're trying to get across, and a lot of people don't want to talk to that attorney. They don't want to talk to that police officer, but to get the best result for your child, you got to do it. And so that's what we're trying to, demystify some of this. And then a very practical thing is, let's face it, this is Friday afternoon. And so if we have movement and we, move from room to room, it helps with people's awakeness. Every participant participates in these breakout sessions, and then we come back for a wrap up. I then present the outcome of the case, what happened clinically and socially with the child, and then any wrap up questions. So if you look at the outcome or at least what the students feel about this, and let me explain this. So the red and the blue graphs are the composite scores on these various domains of all of the domain or system, health system sessions for academic year 22, 23, 24. And that's the years we've looked at. And then the gray on the left are the pediatric ones for the 23, 24 years. So you see that if you just look at it, you say, you know, the students highly ranked peds above the other ones. So let's look at that a little bit more. So we looked at this quantitatively, again, using scores and questions from the school. And they were tabulated and then aggregated. And then we tried to looked at some qualitative data, and we used something called sentiment analysis. I wish Tony was here, but basically sentiment analysis is when you take scripted information like your comments, right? And AI magically assigns a score to positive comments and negative comments. And it's a scale from -1 to 1. So 1 is the highest, you know, positive comments you get, and -1 is a negative score. So in the 2 years, we had 83 students that participated. We had 100% participation rate in the completion, and the overall program effectiveness was 4.4 out of 5, which was a strong showing. If you look at the sub questions, things that stood out to us were helped me to further my professional identity, helped me to think about care through a systems-based lens. Again, that's what we're after, right? So, and then helped me to prepare me for challenges I might face as a physician, change agent, and advocate. Again, child abuse, we think of child advocacy. So, you know, we felt that we really achieved what we were trying to do with these scores. When we looked at the sentiment scores, they ranged, the lowest one was still in a positive range of 0.469 and all the way up to 0.998. And so incredibly effective, great, and informative. The lowest one was a bit longer than necessary. It is Friday afternoon. So, so what are our challenges? Well, it's always a challenge every year to get the presenters to create the environment that I really want. Because everybody just wants to get up there and talk and have their PowerPoint, right? So we should ban PowerPoints. Maybe that's a good idea. I agree. You know, every year we have to work on that a little bit. You know, presenting to students this topic with limited clinical exposure, that's, you know, it's a very clinical topic, but it is a difficult topic for many, and I've become more aware of this over time. And I'll say it again, I'll say it for this group. If I understand the prevalence of child abuse, sexual abuse in our culture, if I look at this room, someone in this room has been affected by abuse, maybe personally or with at least a friend. So we've got to be sensitive to that. And I've become more sensitive to that over the years as we've worked on that. So that's something we have to be careful of. Time constraints, it's Friday afternoon. And then really, this is really qualitative work. Did they enjoy it? But how do I really assess, did they learn from this? So in conclusion, we really felt this multidisciplinary approach to child abuse education complements other approaches, and it seemed to be effective. So overall, it was highly effective, and that's what we've come up with. So any questions?
We do have time for just a couple of questions. Yes, ma'am.
You mentioned that you did this for like pediatrics. Do you also revisit it through the other areas? Because you had mentioned, you know, people with abuse a lot of times have high rates of cancer, and because when those patients kind of advocate for themselves in the healthcare setting, a lot of times they'll mention childhood traumas and abuse, and they're like, oh, that's in the past, that doesn't really affect what's going on with your body now. So do you ever see the ability to put it in other areas too?
I'm not sure how to respond to that. A couple things. I'm a pediatrician, so I wouldn't see the adults. We do, when the forensic nurse presents, it's a forensic nurse who not only works with children, but she does the whole spectrum. So she works with adult abuse too. So she brings up that topic. I can't say that in the cancer ward or the ward where we're with heart disease that we go in and look for abuse. I can't say that, or passive abuse. But that Kaiser Permanente study was a foundational study that's been replicated in other places. So it's a known fact.
Others? Dr. Rapp?
First of all, your talk really resonates with me because I have family members who were abused and seen how that has progressed throughout their lives so far. I was kind of curious as far as you approach this with this multidisciplinary approach for education. How is that reflected in the real life experiences that you have as far as your interaction with some of these other professionals as you work through similar cases in your practice?
Yeah, so that's a personal question a little bit, because when I think about my career, I made a decision a long time ago, because I did primarily hospital-based pediatrics, and we were caring for these children. And I felt if I could give back to society in one way, it would be to be a voice for these children who are voiceless. So that was a conscious decision I made. And so I made a very strong effort to work with these people. So they know me by my first name. I know them by their first name. And so it's been easy for me, but I'm trying to teach others to do that. And that's part of this, to take the fear away, because you may not, everybody, I don't want to go to court. Well, most of these don't go to court. And if you speak strongly and defend what's going on, and the CPS worker knows and the lawyer knows what's going on, then a lot of times these will be settled out of court because they don't want to take it to court because they're going to lose. So, but people are afraid of that. And so I'm trying to help that. And by bringing, when I introduce, I say, I hope you never talk to a Commonwealth's attorney in your life, but here's your one opportunity to do it. Or a police officer. Hope you don't have to interact with a police officer, but here's your opportunity to do it. And so that's what we're trying to demystify a little bit.